Hello everyone, my name is Sadaf Zakiullah, and along with my group members of the Justice League, Emily, Faranak, Cindy, and Sabela, we will be presenting a presentation on justice and First Nations health using a case study of Eddie Snowshoe. Eddie Snowshoe, a 24-year-old federal inmate from Fort McPherson, Northwest Territories of Aboriginal descent, who served time in Manitoba and Alberta, committed suicide on August 13, 2010, after spending 162 consecutive days in segregation, with correction officers unaware he had tried to end his life several times before. His father was killed in an accident at an early age, and Mr. Snowshoe was raised together with three brothers by his mother. Mr. Snowshoe was convicted on May 8, 2007 for shooting and injuring a cab driver in Inuvik during an armed robbery, and sentenced to 5 years at various federal facilities, including Stony Mountain, a medium security institution, and laterly at the Edmonton Institution, a maximum security institution. While in the institution, the Correctional Service of Canada conducted various assessments, including mental health screenings, a nursing assessment, a preliminary evaluation with the parole officer. In Mr. Snowshoe's case, there was an additional Aboriginal social history evaluation and other assessments to evaluate his fitness for incarceration. It was noted by staff that Mr. Snowshoe appeared to be a polite, quiet young man with no known history of violence or mental health issues. However, it was suggested by a psychologist that he had adjustment disorder characterized by anxiety, impairment in functioning, and reckless decision-making when faced with situational stressors. This diagnosis had proven to be a common finding among Aboriginal inmates that were brought up in small communities and dropped among large populations of criminals. Mr. Snowshoe was accustomed to open spaces and familiar faces. Mr. Snowshoe's early interactions with other inmates had proven difficult, and staff noted he was paranoid and vulnerable. Mr. Snowshoe required a caring environment in order to help him cope with his situation. 28 days into his sentence, Mr. Snowshoe attempted suicide. However, he was saved as guards on their routine walk rushed in and saved him. After this incident, staff took the necessary precautions, placing him on suicide watch, and had Mr. Snowshoe go through another round of testing, which resulted in a diagnosis of depression and attention deficit hyperactivity disorder. It was noted by a confidential correctional service report that the presenting behaviors of Mr. Snowshoe demonstrated a gradual declining trend towards poor decision-making and acting out behavior. On March 1, 2010, Mr. Snowshoe was involved in an incident where he brandished what appeared to be a jail-made weapon, which later was found out to be a stabbing weapon made out of a juice box turned inside out. And as a result of this incident, Mr. Snowshoe was placed in segregation on March 2, 2010. As a result of this juice box incident, Mr. Snowshoe was updated to maximum security status in his solitary confinement. Within a month, he was discharged from the Stony Institution and was sent to a new maximum security home, Edmonton Institution. Upon his arrival at the Edmonton Institution, his segregation clock returned to 0, in which there was absolutely no acknowledgement of the time he served in solitary confinement in the previous institution, which was 134 straight days in segregation. The harsh treatment Mr. Snowshoe faced put him on edge, and so on July 16, 2010, he submitted a request for transfer from segregation into the general population, which never ended up being processed. Unfortunately, by the time this proposal had returned in November of 2010, Mr. Snowshoe had been dead for 3 months. On the same day that Mr. Snowshoe submitted his proposal to be transferred out of the segregation confinement, he had requested to speak with a psychiatrist about changing his medications. A nurse had conducted a health assessment with him in which Mr. Snowshoe revealed his suicide and self-harm attempts and was sent out for a follow-up by the psychology department. However, these at-risk concerns were not brought to attention and no interventions were being put together as the Mental Health Committee did not accept referrals from the segregation unit. On the 5th day of an inmate's time in segregation, following a 30-day increment from then on, a review board is legally required to arrange a meeting with the prisoner to assess their health and well-being, as well as determine if the inmate is potentially ready to return to another unit. However, Mr. Snowshoe refused to attend both the 5-day review as well as the 30-day review, as this resulted in a longer stay for him in solitary confinement. On the day Mr. Snowshoe had died, guards on patrol knocked on his metal door and called Mr. Snowshoe's name. As they heard nothing, the guards opened the food slot and looked using a flashlight. Through this food slot, the guards saw Mr. Snowshoe slumped in a corner, a braided bedsheet looped around his neck and tied to a shelf. Mr. Snowshoe's bare feet had turned bluish-purple, and upon various attempts to save his life, the guards and paramedics performed chest compressions and delivered shock using defibrillators. However, none of these tactics seemed to work, in which Mr. Snowshoe had to be pronounced dead.
I will now begin the conceptual analysis by defining the ethical issue, which is whether or not putting Eddie Snowshoe in solitary confinement is ethically sound. I'll start by analyzing the ethical issue using the theory of utilitarianism. Utilitarianists believe that the moral imperative is to maximize good consequences and minimize bad ones, with a formula based on projecting the consequences of each action available, calculating how much happiness over unhappiness will be produced by each action, and selecting the action that will produce the greatest amount of happiness for the greatest number of people. In Mr. Snowshoe's case, the action in question would be placing inmates in solitary confinement. The case states that before undergoing solitary, nearly all inmates insisted that they could handle whatever the guards threw at them. Eventually, the bravado would erode and subjects would divulge a strikingly similar series of symptoms, and that more than half had panic attacks and became so hyper-responsive to stimuli that something like rattling of the plumbing would push them to holler and protest. Nearly a third reported hearing voices or seeing hallucinations, and other common symptoms included uncontrollable aggression, difficulty concentrating, paranoia, and problems with impulse control. Dr. Gracian had theorized that these symptoms form a distinct syndrome, a kind of delirium that has proven irreversible in many cases. In a study conducted by Reiter et al. 2020, 106 randomly sampled incarcerated people in solitary confinement noted a high prevalence of symptoms of psychiatric distress, including anxiety and depression, in as many as half of the participants, and these symptoms persisted into the second year for participants that were out of solitary. Therefore, the consequences of solitary confinement proved to outweigh the benefits for the majority of inmates who are subjected to solitary. In Mr. Snowshoe's case, this statistic proved to be true, as he was diagnosed with depression after he attempted suicide, and after he was placed in segregation, his depression became so severe that he was able to beat his body's defense mechanisms and commit suicide, thus proving that placing him in solitary did not provide the greatest good for Mr. Snowshoe. We can now analyze Mr. Snowshoe's case using the principles of beneficence and non-maleficence within the context of utilitarianism. To provide the greatest good for the greatest number of people, we must follow the principles of beneficence and non-maleficence. The principle of beneficence states that the care that is given should benefit individuals. However, solitary confinement reveals the concentration of some of the most negative effects of the entire prison complex, proving it does more harm than benefit. This is also exemplified in Mr. Snowshoe's case when his solitary clock was restarted every time he transferred to a new facility. Mr. Snowshoe's case was compared to the story of Ashley Smith. With each transfer, her segregation clock was reset to 0, leaving guards with no way of knowing how long she spent in solitary where her health had been declining precipitously. The added time in solitary confinement leads to an exacerbation in mental illness, The psychological harms of solitary include self-harm, anxiety, depression, paranoia, and aggression. This does not provide the patient with any benefit, nor does it reduce harm. Rather, it increases harm, especially with the lack of communication between correctional facilities, which leaves inmates in segregation for longer. In addition, Mr. Snowshoe identifies as an Aboriginal person. According to Council 2014, Aboriginal people comprise about 4% of Canada's population. However, they are overrepresented in prisons, accounting for 23% of the prison population, and nearly one-third of them spend more time in solitary confinement for a longer duration than a non-Aboriginal offender. This racial disparity that a prisoner like Mr. Snowshoe is more likely to be sent to solitary and in turn more likely to suffer there. In Mr. Snowshoe's case, it would prove to be a death sentence. I will now analyze the case using the theory of deontology. This is a duty-based ethical theory that requires us to do the right thing for the right reason. Correctional officials use solitary confinement at their discretion, often with few procedural protections, limited alternative responses, and no external oversight. Using the categorical imperative for imposing solitary confinement, we must ask ourselves if it is permissible for anyone to be in solitary confinement without procedural protections, alternative responses, and external oversight. In Mr. Snowshoe's case, what got him in solitary was a juice box turned inside out. Can it be a universal law that anyone who turns a juice box inside out deserves to be in solitary confinement? If not, then it is our duty to act in a different manner. Catherine Latimer, an executive director of the John Howard Society of Canada and an advocate for prisoners' rights, compares putting inmates in solitary confinement with putting animals in cages. She states, if we found out that animals in a humane society were being caged in circumstances where they were losing their sanity, injuring themselves, killing themselves, society would respond in a very heartfelt way. Therefore, the law of universal human reason would be to choose the alternative that provides the least amount of harm, as we have a duty to do no harm. Using the principle of autonomy, which states that people have the right to make their own decisions, we can see that a lot of the autonomy of inmates, including that of Mr. Snowshoe, has been taken away. By forcing inmates into solitary confinement at their own discretion, without procedural protections, alternative responses, and external oversight, correctional officials are explicitly taking away the inmate's autonomy. Mr. Snowshoe's autonomy was taken away from him when he was not given the right to stay in one correctional facility, despite the fact that he had an adjustment disorder which was exacerbated with every move. Correctional officials are exercising paternalism by deciding when to use solitary confinement at their own discretion without any governing oversight. They are interfering with the inmate's autonomy by imposing their own standards.
After considering all ethical aspects of the conceptual and descriptive analysis within the case of Eddie Snowshoe's death, what ought to be done? To complete this analysis, we need to come up with and implement ways to reduce deaths of prisoners in solitary confinement, specifically deaths by suicide. In a public fatality inquiry report to the Minister of Justice and Attorney General, released 4 years after the death of Eddie Snowshoe, Judge Wheatley of the Provincial Court of Alberta included a number of recommendations in order to prevent similar deaths from occurring in the future. Some of these recommendations suggest an increase in communication when a transfer of prisoners occur, involving a formal report detailing any mental health issues, as well as allowing staff to have access to this information. It was also suggested that staff implement a hand-off system, similar to how nurses give patient reports at the end of shift, so that responsibility for individual prisoners is clear. Clarified guidelines are needed so that segregation timelines and reviews actually occur, and that segregation clock times do not start over when a patient is transferred elsewhere. In regards to the mental health aspect of prisoners in solitary confinement, it is suggested that psychological procedures are reviewed to ensure that prisoners with mental health issues are receiving the help that they need, even if they aren't very accepting of it. Judge Wheatley calls on psychologists and parole officers to keep detailed notes and files for prisoners in solitary confinement, and that interaction recommendations are properly followed up and not ignored. One aspect of the case that Judge Wheatley particularly questioned was how someone with a knife made out of a juice box ended up in solitary confinement for 162 days, and recommends that security classification procedures be reviewed because of this. A very significant recommendation that could make a big difference in reducing deaths of prisoners in solitary confinement is the implementation of observation cells for prisoners who have a history of self-harm or suicide. This would involve a prison cell that a guard could see into easily, so as not to leave the patient alone without any supervision, similar to nurses in an ICU, where they are able to observe from outside the patient's room. The lack of communication when Eddie Snowshoe was transferred to different prisons is of great concern. It is suggested that a better system be implemented so that family of prisoners have access to them, if only to be available to advocate for the prisoner. After looking at the racism involved in this case, it is important to consider how to implement culturally sensitive care, especially in the prison system. It is recommended that a prisoner's Aboriginal status and any cultural issues surrounding it should be recognized, and that there should be access to elders, especially in cases where there are mental health issues. Judge Wheatley's final recommendation was to complete a review for any prisoner placed in solitary confinement so that they can receive any mental health treatment or medical needs due to any issues that may have been exacerbated during their isolation period. We have compared Eddie Snowshoe's case to that of Ashley Smith, as they both died by suicide after spending far too much time alone and segregated, as well as both being of Aboriginal status. 4 years after Ashley's death, a report by coroner Dr. John Carlisle was released that also included a number of recommendations in order to help prevent any similar deaths in the future. Dr. Carlisle insists that Ashley's experience be taught as a case study to anyone involved in the Correctional Service of Canada in order to portray how the lack of care, communication, and accountability can lead to such an unnecessary death. It is also recommended that any female inmate be assessed by a psychologist upon admission to prison, which should also be implemented for male prisoners, and that therapeutic interventions are available and implemented as needed. These therapeutic interventions should be individualized to the prisoner and can involve de-escalation training, art, music, or animal therapy. The introduction of a peer support program with trained and qualified support workers, even for those in solitary confinement, could also be beneficial. It is also recommended that the Correctional Service of Canada ensures that nurses are available on site at all times for both physical and mental issues for both prisoners and staff, as well as access to other community mental health services and professionals as needed. Another relevant recommendation is that any staff providing mental health care will be accountable to healthcare rather than to security, that a therapeutic relationship between the prisoner, client, and the professional should not be compromised or impacted by security-focused assessments, and that any decision-making involved with clinical management or mental health interventions are consulted with the inmate rather than with correctional staff. Another recommendation that relates to nursing practice is the implementation of a least restraint policy, in which other methods are tried before jumping to the use of any type of aggressive restraint, such as solitary confinement. It is also recommended that when there is an inmate engaged in self-injurious behavior, just like Eddie and Ashley, that a psychologist should be on call at all times to help with any necessary intervention decisions and de-escalation. There are also a number of recommendations involved with the transfer of inmates, which include transfers occurring for prisoners with mental health issues only if clinically necessary, that the inmate is imprisoned as close to home as possible, that an electronic database be created so that medical information can be easily shared between facilities, and also that transfers do not occur on Fridays or holidays due to the lower number of staff available. Finally, it is recommended that the Office of the Correctional Investigator monitors and reports on the implementation of these recommendations every year. Avoiding the use of solitary confinement is what will make the biggest difference in reducing the deaths of those who are sentenced to it. As many of these recommendations involve providing people with the care that they need, especially in prison, is the right and ethical thing to do.
On June 2, 2008, the Truth and Reconciliation Commission of Canada was officially created to become a legal settlement between the Indigenous people, including various chiefs and elders and the residential school survivors, and the federal government and the church, as they were responsible for the creation and operation of residential schools. The Truth and Reconciliation Commission's goal was to spread awareness to all Canadians about the truth pertaining to residential schools. In doing so, the Truth and Reconciliation Commission of Canada executed extensive research, which included interviews with anybody who was personally affected about their experiences with residential schools. Therefore, a final report was published that detailed the experiences and consequences of the residential school system, 10 principles for reconciliation, and finally, 94 calls to action targeting crucial sectors of the Canadian society. Thus, in alignment with 3 out of the 94 calls of action, we have curated 3 recommendations for Seneca College that will promote inclusivity for the Indigenous population. Subsequently, we hope this puts our nursing program one more step ahead in resolving ethical issues, health inequalities, and stigmatization of the Indigenous population in our community. Our first recommendation is to educate nursing professors and students about the importance of recognizing Indigenous healing practices. Education about the safe facilitation of these practices should also be taught in the treatment of Indigenous patients. Our second recommendation is to increase the number of Indigenous professors in the nursing program, as well as ensuring an ordinance to nursing staff with regards to the completion of an effective cultural competency training. Our third recommendation is to adapt a new course that solely focuses on education of Indigenous health. Topics that should be included are the history and impact of residential schools, the United Nations Declaration of the Rights of Indigenous People, treaties and Aboriginal rights, Indigenous ways and practices, as well as the predisposed health challenges for this population.
Although it has been emphasized by the Truth and Reconciliation Commission of Canada that all schools and faculties of medicine must include Indigenous health issues in their curriculum due to the deeply entrenched nature of colonization in the current system, this effort has not been operationalized. In other words, there is a significant gap in the integration of Indigenous health in all educational levels across Canada. A recent literature review has suggested the post-secondary institutions have focused on the inclusion of Indigenous health in the educational system and have supported their success. However, lack of transforming structures to include Indigenous knowledge system in educational curriculum is apparent. In nursing, for example, the discourse remains grounded in individualism, which precludes collective commitment to injustice and their expression in race-based discrimination. Healthcare facilities are affected by the stereotypes of Indigenous people within the public, which can often unconsciously influence their practice. As a first component, in order to integrate equity and social justice for Indigenous people in health profession education, it is necessary to go beyond merely raising awareness of negative experiences of Indigenous patients in health system and attempt to realize the broader racist discourses which are rooted in policies and organizational cultures. For instance, integrating approaches such as cultural safety, anti-racist, or intersectional and post-colonial approaches will empower students to develop a sense of responsibilities and commitment to local communities, as well as create a safe working and learning environment. Valuing Indigenous knowledge and epistemologies include ensuring that the content is taught by Indigenous teachers or staff, or that at the very least, Indigenous voices are the heart of the teaching and learning approaches. Secondly, the importance of secure partnership between the community and educational institutions beyond the funding period cannot be denied. To ensure the sustainability of the curriculum implementation and allow for constructive feedback, program development and implementation must be based on the principle of mutual partnership with Indigenous population. This partnership, in accordance with respect, relevance, reciprocity, and responsibility, can lead to articulation and retention of content, elements, learning objectives, and pedagogical approaches. The process of building curriculum based on mutual partnership can take any forms, whether as one-off or one-time events such as one-off campus strategic sessions, collaborative workshops or symposia, or a collaborative approach involving a working group and spanning several months or years. Thirdly, it has been frequently noticed that many educators are hesitant to address ethical concerns and health inequities for this population due to lack of knowledge or appropriate training. As a result, in order to enhance this integration, a training program for teachers must be prioritized. It is recommended to increase their competency by providing safe spaces such as monthly discussion groups where educators can share tests. That many educators are hesitant to address ethical concerns and health inequities for this population due to lack of knowledge or appropriate training. As a result, in order to enhance this integration, a training program for teachers must be prioritized. It is recommended to increase their competency by providing safe spaces such as monthly discussion groups where educators can share their opinions and learning from each other.
Now for the discussion questions. Question 1. A patient requests to use an indigenous healing practice that you know can cause them adverse effects. Under the ethical theory of act utilitarianism, why should the nurse dispute the patient's right to autonomy? Question 2. What other recommendations do you have to help reduce the number of deaths of prisoners in solitary confinement? Question 3. Explain why putting individuals with mental health issues into solitary confinement leads to more harm than good.